8 years ago, Charlie Boast was diagnosed with Alzheimer's disease.
Forgetting, things that are happening or what events are coming up on our calendar and stuff like that.
Where we put things.
Where we put definitely where we put stuff. And
having watched her own father live with Alzheimer's, his wife Heather knew where to go for support.
They become your friends, and you become quite close. And I think, you've said that you don't have to explain that feeling of frustration because the person in your group experiences the same thing, and they understand.
And, so they're not going, huh? Kind of thing.
Their experience has been so positive, they were moved to lend their voices to the Alzheimer Society Evaluation Steering Committee.
We wanted to evaluate some of our core services that we were all offering. So caregiver support, caregiver education, First Link Learning Series, and that one-on-one counseling. So we wanted to find out ways that we could improve the services. Maybe we weren't offering the right services. What could we do to make sure our programs and services were the best they could be?
Evaluators used a mixed methodology, including interviews with staff, caregivers, and people with dementia, and stakeholders, focus groups in each of the 6 sites, 6 key informant interviews, and evaluation surveys with caregivers and people with dementia.
We had 440 people participating in our evaluation project, which I thought is very significant.
Charlie had a role in making sure the survey for people with dementia was client-friendly.
He could read them and he would say, "I'm not quite sure what you're asking me."
I think it really helped us be aware of our jargon and our lingo that we use without even really realizing it. So he helped to ground us and make sure that we were asking the right questions.
The survey responses told the story of the impact the societies are having.
Yeah, well, misery loves company. You're getting to know people on a very good friend basis that are all in the same boat as you. That helps settle you down. You know that you're not alone in the world.
It also validated that their approaches were consistent with best practice research.
That caregivers who had connected with the Alzheimer Society 20 times in the last 3 years, so that's roughly 6 to 7 times a year, had better outcomes. So they were better able to, handle situations in their life. They felt that they had more knowledge about the disease and what to expect in the future. They felt they were able to keep their loved one at home longer.
And that data is rich because it really supports some of the other research that's already been done, like the Middleman study that says, 6 touches in a year is what helps keep caregivers keep their loved one at home and out of long-term care, right? And know where to go for extra support. So what we found really just also supported what had already been established in different avenues and different studies.
The 6 societies are now working on putting recommendations into action.
We might think that we know what people want, but when you ask them, it might be something totally different. So we need to get that client voice. We need to be listening to them to hear what exactly it is that they want.
I also think it gives them credibility and a sense of the value of the work that they do with us.